Yep. Hello, everybody. It is Monday at 4 p.m. Our update today is going to be exclusively on the COVID pandemic. I know a lot of what we're reading about and thinking about is the Omicron variant. 3 questions we're still awaiting to determine how serious or concerning that is. Number 1, how transmissible is it? Is it more or less contagious than, say, Delta, which is very, very contagious? Number 2, how sick does it make you? And number 3 is how well do the vaccines work against it? A answer to any of those 3 questions that comes out in our favor will make the variant much less concerning. And the reason that I bring those 3 up is that it does, at least in part, take our eye off the Delta variant, which we already know is highly transmissible, which we already know is much deadlier than earlier versions, taking younger people away from us. It is Delta that's causing the U.S. average to be the highest that it's been in 2 months. This is the nation in an escalation. And really, there are 3 things that I think are causing this. Number 1, the Delta variant itself. We're all thinking about Omicron, but Delta is the most contagious, deadliest version that we have seen to date. It is currently our enemy number 1, that it is our job to defeat. So this is being driven by the Delta variant, plus waning immunity. That's when you need to get your booster. Plus our behavior. Getting together more, fatigue, wanting to be with family more over the holidays, maybe not wearing our masks the same amount that we used to. So we are in a nationwide escalation, even if some areas aren't escalating as fast as others. We are in an escalation unquestionably now here in Kentucky. We'll show you that in a little bit. It is driven by the Delta variant, which has already caused us so much harm. And we're seeing significant rise, much like we saw 2 months ago in places to our north that hadn't gotten hit as hard, if you want to put up the next one, as we did months ago. Remember, St. Clair got one of these federal strike teams, that it was us asking for this assistance. And now we are seeing states to our north having hospitals overwhelmed. You're starting to see New York, Massachusetts, and others suffering from hospital capacity issues. We aren't there yet, but folks, over the last 3 days, we're reporting 198 new deaths today. This is still very much here. Again, just because some of us want to be over this virus doesn't mean it is over us. It is still impacting Kentuckians, and you're going to hear about the deaths of a number of people far too young. Saturday, we reported 2,350 new cases of COVID-19 with 67 new deaths. They included a 49-year-old from Ballard County, a 49-year-old from Breckinridge County, a 48-year-old from Casey County, a 38-year-old from Hardin County, a 40-year-old from Madison County, a 41-year-old from Pike County, a 39-year-old from Whitley County, and a 49-year-old from Whitley County. So again, as we look later at our vaccination demographics, you got to get vaccinated and you got to get your booster. If you're in your 30s, your 40s, and for that matter, your 20s or below, it is now everybody that this virus comes for. We are fighting death itself. It comes in the form of this virus. Please use the tools that are there to protect yourself and your families. Sunday, 1,194 new cases, 68 new deaths. They include a 44-year-old from Knox County, a 36-year-old from McCreary County, a 23-year-old woman from Morgan County, a 47-year-old from Ohio County, 45-year-old from Warren County, and 43-year-old from Whitley County. And then today, December 6th, 1,347 new cases, 63 new deaths, including a 38-year-old woman from Boyd County, a 49-year-old from Jefferson County, a 43-year-old from Shelby County. Our positivity rate as of today, 9.13%. So as we look at our stair-stepper chart, we can now see, if you take out that week of Thanksgiving where we didn't have full reporting, we are back in an escalation. We are at the highest point we have been in 9 weeks. Last time we were at this level was the week of October the 11th. So 15,875 cases where we are right now, the highest we have been aside from the peaks or near peaks of each of the escalations that we have had. We are certainly not headed in the right direction. And remember, even compared to the last surge we went through, we have more tools to stop this in its tracks than ever before. And as I show you in a minute, we are at least taking advantage of some of them to a higher degree. So whether that's concern for Omicron or whether that is the reality of what we're seeing in Delta cases rise and more people die, getting your booster shot or getting vaccinated for the first time or getting fully vaccinated has never been more important. Test positivity. Now, this one isn't impacted as much by that Thanksgiving week because we still were able to calculate a rate from before, shows a steady incline. Now, it is not as fast of an incline as where we've been recently, but it is still significantly concerning. Remember, that last surge to the left overwhelmed our hospitals. If we get anywhere close to that, we are going to be in significant trouble again. So let's look at where that's going. We can now definitively say that hospitalizations are increasing. The curve is, again, not quite as steep yet as the last escalation, but remember, we didn't reach our floor again. We didn't get all the way back down. We still had a significant number of people in the hospital before this increase. We saw this a little bit at the end of last week, but ICU census, Kentuckians fighting for their lives in the ICU, also definitely going up. The news that I hate to report because it wasn't as evident as it is now, the number of Kentuckians needing a ventilator just to survive is also on the rise. So every single indication of how much COVID we have in the Commonwealth is going up. Cases, ICUs, people on a ventilator, demand for monoclonal antibodies, everything across the board is going up. We are certainly in another escalation. As of today, 1,077 Kentuckians hospitalized for COVID, 310 currently in the ICU, 168 currently on a ventilator. Once again, 9.13% positivity rate. So with that much COVID heading into the holidays, we need to be careful. This is a time that we all want to get together. My family is going to get together, but we are going to do it safely. So let's go over the tips again for a safe holiday. Number one, get vaccinated. If you have a group together this Christmas season that is unvaccinated, your chances for spreading something really deadly are really high. Whether that is Delta on the rise again or whether that's Omicron, getting together, not having gotten vaccinated, puts the other people that you are with at very high risk, something that I don't think this season is about. It's about caring about one another. It's about protecting one another. I mean, the whole Christmas the whole Christmas holiday is about the birth of a Savior that sacrificed his life for the world and other people. So let's please try to do our part for other people during this season. Second, waning immunity is real. If you have not gotten your booster and it's been 6 months since your second shot of Moderna or Pfizer, or 2 months since you got J&J, run out and get it now. And I'm pretty serious on that. Get it today or tomorrow. Do everything you can to get this booster as fast as you can. If it's been 6 months, You are not as protected against Delta as you need to be. Please get that booster. I can't tell you how many stories, how many people put off getting their booster and have contracted the Delta variant. And it's made them sick. They are much more likely to make it through it. There is still some level of immunity there, but you've got to get your booster. This is the next one. If you feel sick, even if you got a cold or you think you have a cold, don't go to a gathering. And you know, we've been through. My son had a cold, got tested, it was negative, but had a cold at the end of last week. Couldn't go to a friend thing that he wanted to. This is what we have to do for one another, right? If we are sick right now, we can't risk the health of everybody else around us. And even if you just have a cold or the flu, please don't go out and give it to other people, right? So, and don't go to work. I know people are worried about sick days or the rest. Just please don't go to work if you're sick. If you're out of sick days, call your employer, right? They don't want you to come into work if you are sick right now. Wear masks if indoors and unvaccinated and or unboosted, right? If you want to have that fully maskless celebration, we need everybody vaccinated and boosted for it to be safe. And finally, I'd just be careful about having a whole bunch of people indoors at the festivities. So those are just a couple of tips for having a safe holiday. I want everybody to have a happy Hanukkah and a Merry Christmas and a safe New Year's. These are special holidays talking about being the light or the light of Christ. It's times like this where we can be the very best and protect one another. And let's make sure that everybody is at this Christmas, is at next Christmas. I've lost 2 people that were at last Christmas for reasons other than COVID, but it really hurts to not have them here this Christmas. Let's make sure others don't go through that based on a virus that we can prevent. We can prevent that loss by getting those vaccines, those boosters, and doing it right. All right, since we last talked, new guidelines for international air travel. The Biden administration has put this out. Those that are going to travel internationally need to know about this. So all travelers 2 years of age or older who are returning to the United States, doesn't matter if you are a citizen or not. If you travel outside the United States and you are coming back, you are going to need to know these things. Number one, you're going to have to show proof of a negative viral test performed within 1 day of your departure. In other words, you got to go get a test in whatever country you're in outside of the United States within 1 day of when you left to come back. That's important to schedule, to know where it is. If you're planning international travel, look up where to get tested before you leave. Second, you should get tested 3 to 5 days after your return. Third, you should self-isolate and get tested if any symptoms are developed. And finally, unvaccinated travelers should quarantine for seven days. So all of this is important. We should follow all of it. But remember, you got to get that test before you get on the airplane to come back to the United States. So for international travels and travelers, important to know. So all that's a little scary, right? Delta's going back up. Omicron is here. So let's have some good news. We are seeing more vaccinations, more over this last weekend than we have seen in a long time, and it's in every stage of the vaccination process. So 15,117 Kentuckians decided to get vaccinated and got their first shot over the weekend. That is a pretty good number compared to what we see most weekends. 18,189 got their second shot to become fully vaccinated over the weekend. And look at that number on boosters. It's picking up significantly. 45,137 Kentuckians got their booster. We need to really see a number like that almost every day for where we need to get to fight back against Delta or Omicron We need to see these types of numbers, but certainly vaccination numbers going up, at least over the last 3 days. Total number of Kentuckians now that have had at least one shot, 2,703,247. And as we'll see in a minute, it brings our percentage up a point. Now, 61% of every man, woman, and child living in Kentucky has received at least their first shot of hope. We are now 53% of every man, woman, and child, and that's not just eligible, fully vaccinated. And 14% of all Kentuckians have had 3 shots. In other words, is fully vaccinated plus gotten their booster. 640,061 booster shots have now been given out in Kentucky. Pretty incredible when you think about how short of a time they've been available, but we have enough to do a lot more and to get people boosted a lot faster. So there's one takeaway from today. Get your booster shot before Christmas. If you're getting together at a gathering and you haven't done it, get your booster shot as soon as you can to give it time to fully kick in before Christmas. That's a gift that you can give everybody else there by being having the highest levels of immunity possible. So something that we can all do to protect one another when we get together. A small act, especially if you've already gotten fully vaccinated. Go get your booster. Do it before Christmas. So let's look at the age breakdown now. Again, 2,703,247 Kentuckians having at least their first shot. Our total has gone up 1%. These are all Kentuckians. 61%, even if you are not eligible. 64%, almost 2/3 of everybody who's eligible has gotten at least one shot. That includes 5 to 11 that hadn't been open very long. And then this next number, I mean, in any other time, against almost any other virus, would be unheard of and would be an unparalleled success. 72% of everybody who can make their own healthcare decisions has decided to get vaccinated, and we have done it in less than a year. It just shows you how strong, how difficult of an adversary we're facing is. With perspective and time to look back, I think this will be an incredible success story. And remember, we didn't have a network a year ago to distribute these. And now it's so robust that we can do 640,000+ boosters without adding another provider. So as we go through the age brackets, excited to see this one, 75 and up, now at 91%, not at 90. Every tick on this one is important. 65 to 74, still at 94%. That's a little harder to move. 50 to 64, up 1% to 78%. 40 to 49 stayed the same. And folks, remember how many 40 to 49-year-olds that we lost just on today's report. So please go out and get vaccinated. Remember, we've seen that jump from about 2/3 up to about 78%. So there has been to 68% from about 50%. So there has been some movement. 25 to 39 went up a point to 59%. And then the others remain constant to 5 to 11, which has increased by 1%. But we do need to see more. All right, shorter report today. We'll open it up to questions. We have 3 journalists in the room, and we've got about 9 joining us virtually. So we'll start with Tom Latek. It's not a press conference without a question from Tom.
You're telling me, man. You were talking about all these methods that we have to fight this thing, yet the number of cases are going up. But I'm sure you probably asked Dr. Stack, what's with this? What are you hearing from the health experts?
Yeah, so we have all these tools, but cases are still going up. It's really 3 things. It is the Delta variant and how powerful that it is. It is waning immunity. And it is human behavior. It's colder. People are coming inside, and we're coming together for events, for celebrations. We're doing more things. We have large concerts and other events that are out there. It's those 3 things that drive it. The number one thing that drives it is the vaccination rate itself, right? If the vaccination rate was 100%, even with waning immunity, our cases wouldn't be where they are right now. If there wasn't waning immunity, our cases wouldn't be where they are right now. So we know if we can get more people vaccinated, that helps. We know if we can get people boosted, I think that helps a lot. And the boosted part is really one of just urgency, right? These are people who have already decided that they're willing to get vaccinated. We just need more urgency with it. And then we just got to be a little more careful. Karen?
Governor, your hands are tied now. But are there any COVID safety protocols that you think should be in place that are not? And then another question is, what lessons did we learn from the last surge in case we do need more help when it comes to hospitals that will move things more quickly?
Well, I think that just about every business where people are in close contact should start requiring masks if they're not right now. I think all of our schools need to get back to universal masking because how quickly it spreads in a community through schools. With this escalation, we have 80 to 90 counties at least in the red. These are methods that not only can reduce the spread, but protect your workforce. So I was asked the question, especially when cases were going down, what about state office buildings? Would we go to mask optional? And what I was looking at is, number one, we need enough time, but number two, it's protected my workforce. You know, we haven't had one significant outbreak in state government since we went to it, meaning all those services we do, from bridge inspections to driver's license to processing claims to so many critical things. We had everybody showing up for work, healthy, each day to do them. And so I certainly think larger venues ought to really consider masking. Proud of UK basketball, for instance, requiring masking. Just where we are right now, I think it's smart. And then I think we ought to double down, whether it's in our communities and our businesses or the rest, on encouraging the vaccination. And as you can see from those numbers right now, more people are considering it for the first time than in a while. Though I will say that while our vaccination rate isn't enough, it's never stopped, right? Every single day we've had 1,000+ people choose to get vaccinated for the first time. Chad Hedrick.
Looking at the hospital rates and those graphs that you showed, I mean, that's a sharp kind of curve right back up to, thankfully, not exactly where we were at the peak, but as we know, it doesn't take much to really get there. In terms of communications with hospitals, trying to get maybe some extra help,
right,
as a proactive approach, is that ongoing?
So one of the lessons learned is knowing when to ultimately turn on some of the assistance levels. We've seen the National Guard and what a huge help they are. They're still in some hospitals, and ones that need them, there's no reason at the moment to pull them out, especially with this increase. There's continued work to connect hospitals and nursing programs. You know, we were able, I think in the very beginning, I was able to do the first connection there to get more students in hospitals, but to get a more direct relationship there so that they can bring in people on an as-needed basis. Lessons learned, especially our lower level hospitals. By that, I mean they're not equipped to typically treat as sick of patients as we've seen, making sure that they are ready to turn on that expansion of the ICU and the other things that we've seen in the past, and knowing the equipment that we have and being ready to get it out and distributed faster. All things that we need to be ready for. Hospitals aren't sounding the alarm yet, and certainly there is a hope because either people getting boosted or who have just had it hopefully will have higher levels of immunity, at least against Delta, that we won't go as high as fast. That's certainly, but remember our last escalation wasn't around holidays, right? It was at a time when more people could be outside. So we're gonna have to wait and watch and see. Bodie Brooks from Fox 56. Okay, Alex Akisto from the Herald Leader.
Hi, Governor. You, for most of the time weekly, I think, provide a breakdown of the percentage of unvaccinated versus vaccinated in cases, hospitalizations, and deaths from March 1st to present day. What's stopping the state from releasing a breakdown of vaccinated versus unvaccinated daily in new case reports? And secondly, I can't remember if you said this earlier in the press conference, has Omicron been confirmed yet in Kentucky?
To my knowledge, as of standing here right now, we have not confirmed a case of Omicron. With that said, it's been detected in so many different states, it is likely here. It would almost be surprising if it is not here. We ought to remember that those three questions, we need definitive answers to know how worried we should be. And they've switched back and forth, right? And what we've heard, at one point they were saying they thought it made you sicker than Delta. And now they say maybe it's milder, or maybe it's even a lot milder than Delta. And milder than Delta could still be really bad. So, the degree there is important too. Let me ask about the daily case counts. I do have to look at the level of work on the number of people that we have. But let me look at that. If we are getting that information on a daily basis, and it doesn't pull somebody else off of something that's really important to do, that's something that we'll happily take a look at. We want to get as much good information as we can out there in a reasonable fashion with our workforce. Debbie Yetter, the Courier-Journal.
Hi, Governor. Following up on the rate of vaccinated versus unvaccinated, given the numbers you cited to date, are you seeing an increase in the number of so-called breakthrough cases, or is this still largely something that affects the unvaccinated?
So we haven't had an update on the overall chart, if you can pull it up, since last Thursday, and that only goes through December the 1st. No, the other one, if we can. That one's helpful. Here we go. This is the one we showed on December 1st. So if you look at all of those numbers, Debbie, we would say that this is significantly, at 80-something%, you might even say overwhelmingly, unvaccinated individuals getting COVID, being hospitalized for COVID, and dying from COVID. But with that said, these numbers were even higher, meaning the percentage of unvaccinated individuals getting COVID, being hospitalized for COVID, and dying from COVID was higher. So it is primarily unvaccinated individuals. But then I'm willing to say, from what we see now, it is secondarily unboosted individuals. That I don't think we have the chart here, but we can show how the breakthrough cases have increased every single month since the level, so really 6-month stage, and that waning immunity is real. So now it's two things: it's getting people vaccinated and getting people boosted. And I actually believe that can get us back to a really good place. But we need people to get vaccinated for the first time and to have more urgency in getting their boosters. So, it's one additional nuance that we now understand better. I hate that there's waning immunity, but I'm grateful that we know that it exists. And we were one of the first states to go ahead and say booster for everybody above 18 because we can address it. So again, everybody get your booster shot before Christmas and certainly before New Year's. Chandler Wilcox, the UK Student News Network.
Yeah, thank you, Governor. You mentioned the booster. That's actually what I wanted to talk about. Why do you think that there's maybe a lack of urgency with it, and what can you do to increase the urgency for that?
It's a good question. So I think we can say the urgency is increasing based on the 45,000 from this weekend that I want to say was 15 maybe thousand the weekend before, but getting the information out there I think is so important. And so when you're fully vaccinated, you are better off. And we're showing statistics that are 82 or 84%, but those numbers again tick down every week, and you don't want to be the person who put off that booster and ultimately got the virus. And it's admittedly a nuanced message, because if you're fully vaccinated and you haven't gotten your booster, you are still a heck of a lot better off than if you're unvaccinated. You're less likely to get COVID. If you get it, you're more likely to have a good outcome. But if you get that booster, you can push your immunity levels up to where you're not only a lot less likely to get it, you're also a lot less likely to spread it. And so sometimes I think it's some of that nuance. We rightfully encouraged vaccinations, and we rightfully continue to talk about how being fully vaccinated offers you protection. And then it's adding that layer on. And sometimes you hear people say, well, first they told me to do this, and now they tell me to do this, and this advice changes. I mean, we're at war with a complicated enemy that mutates. And Omicron has how many mutations off of it? I mean, we've got to understand that if it's changing in order to kill us, we've got to be willing to be flexible in our approach to prevent it from killing us, and then to ultimately win. Andrew Colgrove, WSAZ. Okay, we'll come back. April Rickert from WFPL.
Hi, Governor. Thank you. Researchers who test wastewater for COVID levels last week in Jefferson County found higher levels than the surge a few months ago, although no Omicron yet. Is the state doing anything to respond to those levels, and how will the state respond if Omicron's found first in wastewater? Thank you.
Well, again, the response for Omicron is going to be very similar to the response to Delta because we have the same tools, vaccinations, masks, and ultimately some of the distancing and other measures. So really, we have the playbook. It's just, will we have to make some minor changes? Biggest concern is if there is a surge, where's our hospital capacity going to be, and are we going to have enough monoclonal antibodies? So a couple of things on monoclonals is that there are now 3 types of monoclonal antibodies. By the way, one type is now approved for people of any age. So your kids, if they're getting sick, can get them. But we have to give out all 3 types, and we can't provide a preference to people unless they're all readily available in an area. If we do that, the federal government does not ship us the next grouping of them. So I expect that there will be a scarcity of monoclonal antibodies in the United States. I'm hoping Kentucky, based on what we've been through, is not an area where we end up with more demand where we are than supply. The wastewater treatment and detection, a lot of which I know came from a group in Louisville, is incredible. I mean, it's an incredible tool to know when there is COVID, and certainly we use it now in all of our prisons, and it gives us a good idea of what we're seeing. Obviously, the things that we can do are more limited with what the legislature has done, but we'll continue to work with the area hospitals, with the local health department, with the school system. Jefferson County continuing to mask is going to be a big help. Now, if I was a private school in Jefferson County that went to masking optional, and I saw that we were back in a surge and we had 40-something-year-olds dying in Jefferson County, and the wastewater numbers are where they are, I'd say, we can either act now and try to stay in school and protect everybody, or we can wait until we see our numbers go up, which means we are reactive instead of proactive with people's health and safety. Melissa Patrick, Kentucky Health News.
Hi, Governor. What are you hearing from Kentucky's hospitals right now? Are there any immediate concerns about them becoming overwhelmed with this, what looks like a new surge of COVID metrics and cases and positivity rate, et cetera?
So no immediate concerns, but listen, everybody's wary, and what we all lived through was so difficult. And overall, staffing, after living through something that traumatic, certainly hasn't been able to bounce back, though we have more tools at our disposal, certainly to help hospitals, having learned some lessons, and you know, in the coming weeks, I hope that we'll be able to announce some changes to start boosting our nurses and other workforce that can be out there. I've had some very good meetings, including some today, on that. So, I mean, everybody is overall concerned because of where staffing is and seeing cases starting to go back up and hospitalizations, but no one's sounding the alarm yet, and I think rightfully so, wanting to see where this continues and for how long. Stu Johnson, WEKU.
Thank you, Governor. Good afternoon. Unfortunately, you did report a number of deaths today, over the weekend, for that matter, for sure. Is it known if any of those are tied to the Thanksgiving holiday period, or is it prior to that? Are they prior to that?
I think most all of these are prior to that. Certainly the list that comes out today will include all of the dates. And as I'm looking over the first one, you know, the latest date of death was actually my birthday, was November the 29th. Now that would be a really fast progression if you got it on Thanksgiving and ultimately even passed away on the 29th, certainly possible. But no, this is, there are a handful of these, I think maybe 22 or so that would be pre-September, but most all of these are September, October, November, and that's really when we started seeing the numbers start to go back up. So no, anything that we're going to experience death-wise that results from the Thanksgiving Day period, we haven't even seen yet. Let's hope that everybody was careful and got that booster. But after seeing all that, again, please get your booster before Christmas or New Year's gatherings. Do we know if we've got Andrew? Yeah. Okay. All right, everybody. That's our briefing today. Again, it's always tough news after we were coming down on cases to see them going back up, but we've been here before. We know what to do, and we're tough enough to do it. And let's remember, just because we're tired of dealing with COVID doesn't mean it's done with us. And remember, our behavior not only is the protection that we provide to ourselves and our families, but the community around us. We all know multiple people now that have passed away because of COVID, and we have the power to prevent that from happening moving forward. So please do your part. Thank you to all the people, I mean, the most we've seen in a while over the weekend, that got your first vaccine. We know it may have been a difficult or confusing or whatever the road was that led you to that, and whether you were happy to get it or finally just did, thank you. Now I don't want to be pushy. I don't want to be difficult. Typically, your job in this is to make as many people happy as possible. But we want you to be alive, and we want to be post-COVID. Everybody who's gotten their booster, thank you for showing the urgency. If you haven't, go out and do it as fast as you can. That'll help you, and that'll help us. You've already done such a great job in helping us get through this. Please get that extra shot. We will be back on Thursday for our Team Kentucky update. We think we're going to have some more incredible economic development news, that this record-shattering year in terms of investment is not over. Got a good chance at breaking the overall newly created jobs record as well. See you Thursday.